what does that mean, restoration implant? Does that mean if I have an implant, you would fix it?
Oh, so it's like, so restoration on implant means that, the implant is, when we say implant itself, like general view is that it actually consists of 3 parts. So the implant is actually the implant body that goes in the bone. Okay. And then there's the connector piece, and then there's the crown. So in general, we just say implant, we refer to all those 3 pieces together because that's the end product that you can actually see in your mouth. Whether a surgeon places an implant or specialist or a general dentist places an implant, that's the implant body that goes in the bone that takes place of the patient's root of the tooth. And then we can put a connector and a crown on top of that. That's what is referred to as a restoration of an implant. I mean, restoring that implant, like building on that implant so that you could have a tooth in your mouth which you can actually use.
With you guys, you would do, I guess, maybe refer out for the actual, like, in the bone
implant body,
and then come back and you could put the crown on.
Crown on, yeah. So one of our practice actually in the one Smiles by the Sea Family Dentistry in New Hampshire, we have a periodontist who comes to our office, and she can place implants.
Wow.
So, she does place implants. So, if she places the implant, we monitor you, and then when the time comes, we get a green light, the implant is ready, we can, make it useful now, let's go for it. Yeah.
Right.
Yeah.
Well, how long does that process take of, like, getting the implant placed and then the crown on top of the implant to now that I can, like, actually chew on it?
Yeah, great question. So it's typically 3 months.
Oh,
yeah.
That's not
So
bad at all.
Yeah. So give 3 months of time so your bone can heal around, hug the implant tight so it doesn't move, it becomes part of your body.
Wow.
And then we are able to, put the other part so you can chew on it.
Wow. And it would look like the rest of it.
The rest of the teeth, yes.
Oh.
Yes, yeah. They have come a long way. So
Wow.
very aesthetic.
Wow.
Yeah.
Are there any restrictions within that 3-month period of, like, maybe things that I can eat or can't eat? Because that sounds like a very intricate process of it, like the bone is attaching to the implant. So I don't want to mess that up.
Sure, it does. It does feel like it's, when you think about it, it's something going in your body and it seems very traumatic, but in actuality, from what I have heard from patients, and it feels like that, but most of the patients say the healing was actually much easier than they anticipated.
Wow.
Because it's an additional process. We are putting something in the body, we're not taking things out. So it heals up, most of the time. I mean, there are some exceptions that, some areas where it could be complications, but most of the time it heals very, very well. And, right after they place it, yes, for a week or 10 days, there would be certain things that you have to follow some, adhere to some of the protocols and precautions, do's and don'ts. But typically after that, once the, gum around that heals, obviously you want to avoid, like, eating very hard stuff, chips or things like that, which can injure the tissue. So just giving the area, leaving it naturally so the body can heal around it, giving it, a very good and, unaltered environment. So just a nice healing can happen.